Hi, my name's Kelly. I'm a CBT therapist and forensic psychologist. And today I want to talk you through the vicious cycle of depression. So when people are feeling depressed, they often get stuck in a cycle. And because they get stuck in that cycle, it's really difficult for them to be able to pull themselves out of it. And because of that, it maintains their feeling of depression. So I wanted to talk you through a basic cycle and to show how you can use it potentially to reflect on yourself or maybe with your clients. So for example, if you start it with, okay, so how are they feeling? So feeling depressed. And then because they feel depressed, what is actually going on because of that? So they feel depressed. And then because they feel depressed, and they have low motivation, they may feel quite fatigued, or they could have just, obviously the low mood would come out in terms of they're feeling depressed, but they may have low energy as well. So they have all of this going on for how they're feeling. And then because they're feeling that way, they start to think negatively. So that's when the negative thoughts come in. So we've got the emotion here of feeling depressed. You've almost got the behavioural, so that kind of low motivation, low energy, feeling quite fatigued. But then that's when the negative thoughts come in. And because of those negative thoughts can sometimes make them not really want to engage in other activities because they're feeling fatigued anyway. They haven't got the motivation to push themselves to go and do it. And now they're thinking negatively, maybe thinking badly about themselves, their abilities. So because of that, as I said, that could maybe potentially lead people to avoid certain situations or activities. So there's the avoidance, maybe less activity. Maybe general withdrawal from maybe social activities or engaging with friends or family, or just anything that they may have been doing before. But because of that, they're still feeling low. So that can also lead to some other emotions potentially. So that may lead them to feeling quite sad. So they may have some sadness. They may even feel guilty because they're maybe cancelling plans, or they just don't feel able to do it because they just feel so low and they're withdrawing because they're stuck in those negative thoughts. So there may be some guilt there as well. Obviously, there can be other emotions, but they're just some two that you could pull apart. And then because of that, they continue to feel depressed. Oops. So that is a vicious cycle of depression. So as I said, you can definitely adapt this for the clients that you work with. This is quite a generic one, but it can be quite helpful to show someone, okay, you're feeling depressed, but this is why you're continuing to feel depressed, because you've got all of this going on. And you can easily see how that cycle would keep someone trapped until you use some techniques, whether it's CBT or another modality, to be able to challenge some of these areas. And once you start to challenge some of them, you're pulling that out. So if you pull out the motivation, if you take that away, cycle's not going to be able to go on. So that is the beauty of being able to use CBT as or other modalities, because you've broken that cycle, you've broken that vicious cycle, so people are able to get out of it. So this is often used at the beginning in sessions with someone to really help them to understand their depression and their experience, but it's something you can often refer to when you're bringing in the intervention to show someone how CBT is going to be able to help them. So I hope you found that helpful. I have lots of other videos and techniques on my YouTube. Please like and subscribe and let me know in the comments if you found this helpful and also what else you'd like to see on my channel. Thank you.